Welcome to the Researched RN podcast. I am your host, Stephen Kuzmenko. In this podcast, I discuss new and interesting peer-reviewed research articles from various nursing researchers and other professional publications. In this episode, I'll talk about an article published in the June 2022 edition of the Journal of Patient Experience titled Development and Validation of the Psychiatric Inpatient Experience Survey, a novel measure of patient experience quality improvements. It's authored by Klemansky and colleagues. And today is another special episode because I get to welcome one of the authors on this work, Dr. Cynthia Bautista. So, Dr. Cynthia Bautista, welcome to the Researched RN podcast.
Thank you, Stephen. I'm so thrilled to be here. So thank you for the opportunity to share my work.
Yeah, I'm really excited to hear this. And you're going to come at it in a number of different ways, and I've had in with guests in the past. And so I'm really glad to hear that from you. And you'll just highlight this amazing work that you're doing as a nurse. I don't want to share too much just yet. I want you to be able to be the one to tell us that. So, but just let's start off just getting to know you. Just tell us a little bit about yourself. What do you do? What does a normal day look like for you?
Okay, great. Yep. So I'm a neuroscience clinical nurse specialist. So again, I'm in the Northeast. Over the past 20 some odd years, I've worked at one of those mecca institutions, those big medical center university hospitals. Although I did retire from them in December 2025. So I'm a retired neuroscience clinical nurse specialist. And then I'm also a professor. Actually, I can say now I'm a professor emerita at, again, another private university here in the Northeast. And because I retired from them this past month in May. Uh, so two jobs, two big things that have brought tons of experience for me. But I continue to work. I'm a nurse entrepreneur. I own my own business, Nursing Brains, and that allows me to travel the world and provide neuroscience nursing education. And that's one of my passions. So, yeah. So, my day in a life is traveling the world and providing education.
Wow, we can have you on for a number of episodes just to share all the adventures you get to have. What nursing has brought to you as a profession. I think you're a great example of that. And so today we are going to talk about patient experience in specifically the psychiatric population. And so tell us just briefly about the background of this work. Why do we need to look at these patients specifically? Why has this population been a challenge?
Yep, exactly. Okay, no problem. So, first of all, I want to give a shout out to my two colleagues who we did this work with and who I published with. So, first, shout out to Todd Barnes. He is a data analyst. And it really was his question coming to me as the clinical nurse specialist. I need some evidence because that's what a CNS does, finds the evidence on patient experience in an inpatient psych unit. And then I do want to give a shout out to my other colleague, Dr. David Klemensky. He is a psychologist. And so he brought in that physician perspective of caring for patients in the psych arena. So how this all happened, just like I said, Todd needed some survey, a tool, an instrument to measure patient experience at this Mecca institution. And so I went out, I searched the evidence, I found one, we tried it, and guess what? It didn't work. So, again, go out there, look for instruments, look for tools, try them, see if it answers your questions. And like I said, none of the tools that we found did. So we created our own. So that's what this article is all about, how we could not find a tool and how we created one.
That's incredible. So you had a tool that didn't quite work. You guys worked on creating a new one. Just for, in a nutshell, bird's eye view, what are some of the initial steps that you need to take when you develop an instrument or a measurement tool that can be used in healthcare?
Yeah, and I recommend any nurse, yeah, bedside, whatever. Again, if you need to create a tool, an instrument, a survey, that was one thing kind of you have to catch. What are you going to call it? Are you creating a survey? You creating a tool? You creating an instrument? What is it? So we had that discussion, and again, consensus. We said we're going to call this a survey. So, what is it that we want to measure? Do we want to measure patient experience? Do we want to measure patient satisfaction? Because that is another concept. So we went with patient experience because the idea too was this survey was to collect data on patient experience. And then what are you going to do about it? So that was another part of creating this instrument. So we did the classic way of how do you start a survey is again, look at the literature. So, how you're going to create, what is the content? What are the items on it? It's all about review the literature. So that's what we did. Patient experience. We again focused on inpatient psych. Then another thing you're supposed to do is focus groups. So we got some patients together and did several focus groups. The other thing you're supposed to do is a expert opinion. So you gather a group of, we did a social worker, occupational therapy, we had physicians, we had a chaplain, so who has this expert opinion of what should a inpatient psych unit experience be? So once we got all that information, then kind of get some themes going. So we came up with four themes. So for inpatient psych, it is treatment team relationship. That came out very strong. Healing environment, very strong. Nursing team presence. And last but not least, treatment effectiveness. Now we have four themes, but we need some items. So again, when you're developing your tool, your survey, how do you figure out what are the questions? So a couple of things. The evidence or the way you do it is you look at existing instruments. So, there's a handful of instruments out there that look at patient experience or psych patient experience. So we looked at them. Again, the review of the literature, and we did kind of find they're called concept analysis. So what does a concept analysis say about patient experience? And then a bottom line, clinical observations. What did patients and clinical experts say that should be on, or what kind of items should we be asking about to make this a really good patient experience? The other thing you need to think about is how many items are you going to put on your survey? So again, bottom line, we wanted not too many, because you guys know, not too many, all right, not too few. So we started with 28. We started with 28 items. And then what you do is you put those items through psychometrics. And we ended up with 23. So 23. Just food for thought. When you're creating items or you're thinking about creating items, it's kind of interesting. So again, how many? Think about, are they all positive items? Is some of them going to be negative items? And then how are you going to measure it? These items, how are you going to measure it? And so we went with the Likert scale, and there's data information on scales. Likert scale, definitely go with the odd number, right? 1 through 5, 1 through 7. We went with 1 through 5. And what did you want that Likert scale to say? And we wanted agree. Do you agree? So, right, this survey goes to patients, and we wanted them to agree that this is a good patient experience, right? So, again, always have to go back. What is it that you're going to measure? How do you want to measure it? What are you going to use? I'm just going to take a pause there just in case
Yeah.
you want to clarify anything or.
No, so that is, you explain that very well in how you just, it really seems like in developing an instrument you'd have to have an idea, a need, you have to see how it was addressed previously by other professionals in the same field, and then you tinker with it, right? And doing so really methodologically consistent, and using, you can't just administer a survey and expect to get data and trust that what you're asking is actually what's being represented in the numbers.
That's right. That's right. And that you bring again, Stephen, bring up a good point. Research, right? When we say research, what do we mean? Rigor, right? Rigor. And so when you create instruments, it's called psychometric properties or psychometric measurements. So you can pick up any nursing research textbook or book, use your AI or use your Google. And how do you get that rigor with this survey? Is this, and again, always go back, is the survey measuring the construct, the concept that you're trying to measure? I can tell you, David Todd and I, we constantly would remind, look, we're looking at experience. We're looking at it from the patient. This is the psych patient who's been in the inpatient unit. Always going back to what is that construct. And don't forget the evidence. We always going back. And this took us several years, right? So every year you have to go back and look at the evidence. Has somebody beaten us to it and created a patient experience survey and we didn't know? So lucky for us, nope, they did not. So we're still kind of one of the only patient experience for psych out there. So we're kind of psyched about that.
It sounds like you really had to hinge on your clinical experience in developing, because, people might think research is really far removed from the bedside, from the interactions that nurses and patients or clinicians and patients have, but you had to really consider the experience of where that psychiatric patient was, the, issues they're dealing with, and then where and how you wanted to ask them the type of information, but you were really hinging on your clinical experience.
Absolutely, absolutely, yeah, and you always have to keep going back to validate, right? It's called validation. Like, is this survey valid? So if I say that, I'm gonna bring up the other 2, like, statistical tests that are very popular for an instrument development is you start with this test called exploratory factor analysis, right? So this is going to explore and look to see, are your items that you created, do they correlate to, for us, a psychiatric patient experience? So we take the items, we gather some data from the patients, we throw it into this exploratory factor analysis program, and it'll tell us, yes, that item correlates with the other items and your themes. So I won't get into the deep written, the nitty gritty, but it's all about, they give you values and you have to look to see, did you get your value? And so I can tell you, for example, for our exploratory factor analysis, we surveyed 462 patients, 462. Now, ideally, we only needed about 200, but we did the 462. And we only had to throw out 5. We had to throw out 5 items because they just did not correlate or reflect psychiatric inpatient experience. So now we're down to 23 items, which is very, very doable. So we're down to 23 items and 4 themes. So we were very pleased with that. Now, once you've aka explored, and have a pretty valid survey, then you can confirm. Then you throw all your data, you collect more data, you throw the data in, and it's called confirmatory factor analysis. And so here again, do these items that you've created, do they belong to specific focus. Like the items that we have, do they belong to the healing environment? Do the items belong to the treatment effectiveness? So that's what this, statistical program will do for you. And so for us, what the program showed us, or our results were, four factors. So these four factors that we thought proved statistically significant that these are okay. So we have a pretty valid survey here.
And then the thought would be that, you know, anyone that uses this survey can confidently administer it and know that they're measuring, you mentioned treatment team relationships, so the relationships between the team, within the team, the treatment effectiveness,
Yep.
the nursing team presence, and the healing environment when they administer that survey. By doing all those steps that you very well eloquently outlined, I'm learning so much talking to you. You That data can be then, you can be very confident that it's reflecting those things in that person's life.
Yes. Yes. And what else we did, or another aha about this particular survey. So then you're like, okay, you're getting results, right? You've created a survey, you get results from your survey, and what are you going to do with it? Right? You got to say to yourself, what are you going to do with it? And for us, we wanted to make sure that the data we got off of this survey would what? Improve patient experience, improve the experience with the treatment team, improve the experience with the healing environment, improve the experience with nurses, and to improve the experience with treatment effectiveness. So what we were able to do is, based on the results, based on people filling out the survey, right? And we're tallying up the results and the scores. We can see on a specific unit what area needs help. So again, I don't know if you know what I'm talking about. It's called quality improvement, right? So you can use research to gather data, right? But then what are you going to do with the data? You want to improve the process, right? The process of patient experience. And so that's what we did. And I'll share a little of the outcomes with you all.
Please.
Okay, great. I have to tell you, we're very proud. Our numbers, our results were fabulous. Fabulous with the treatment team relationship, fabulous with the nursing team and the treatment effectiveness. But guess what? The healing environment, right? It's all about your room. It's all about sunlight, going outside, staying inside, cleanliness, right? Healing environment. So that I can tell you was the most common theme, or the most common domain that most units struggled with.
Well, and I'm sure that's a challenge in a lot of places because the population, you guys allude to early on in the intro, how it has to be a restrictive environment because of the nature. If
Of
they're, having
safety,
thoughts of harming, yeah, safety
patient
for the patient.
safety.
Yeah, so it's a challenging place to establish that healing environment, especially from their perspective.
Yep. Yep. You're absolutely right. You're absolutely right. Yep. But sometimes another aha that came out of this survey and using the survey, just like you said, sometimes getting these results over and over again, how, I don't know, maybe the unit isn't bright enough or something. Showing the data to those who are in leadership positions, that data can maybe change their mind, or change the structure, or at least get a paint job, or at least help environmental services do a little more on the cleanup. And you know what I mean? Use your data to improve the experience.
How can that change their mindset? Because, so much of nursing, speak to some of that. So much of nursing is so abstract, like caring for people and a healing environment. Like these things are so abstract. It's not just like measuring blood pressure or weight or height. It's so what are what are some of the things that, nurses can do in their mindset when it comes to these more abstract things that are so innate in nursing?
Yeah. So for me, this particular survey heightens nurses' awareness or thoughts about what is it like to be a patient, right? I feel my experience with psych nurses, they are brilliant. They know the psych disorders and they know how to care for the patient. But I'm not sure there's a lot of evidence and literature about what's it like for the patient from the patient perspective. And nowadays, what is this, 2026? I think there's a big push in having some sense about a patient's experience, either in hospitalization, in illness, right? So for me, this particular survey captured that. So again, we were able to heighten nurses at the bedside caring for these patients, heighten their awareness of what the patient's experience was.
Yeah, I mean, it makes complete sense because before they really had to just go based off what they perceived, and there wasn't really it was probably really inconsistent, and maybe someday they had a bad day themselves, and so there's all these variables when it comes to relying on our perceptions. I think that's a whole separate debate, perceptions and
Yeah.
using your senses and removing your senses philosophically, but we don't need to talk about that. But so what knowing that this is, a leading tool, it sounds like it helped your department,
Yep.
broadly speaking, how can this tool help everyone else, and has it?
Sure. Yeah, great question. So, very, very excited to let you all know this particular article got picked up by CMS, Center of Medicare Medicaid Services, right? It's all official now and starts this year, 2026. All inpatient psych units need to use this survey, gather data, and submit it to CMS. So CMS has adopted
It's
this
incredible.
survey. Yeah, we're very thrilled. That's another whole podcast. How to get a CMS measure.
Yeah, and you're gonna be our first guest. That's
What a
not
trip. What a
I'm
trip.
sure
But
it's not
anyways,
common.
no, no, no. But people across, right, inpatient psych units across the nation have are actually kind of mandated to use this survey. And so far, knock on wood, we have worked with other institutions. And so far, we are receiving a lot of we've done tons of presentations and, we're actually working on another publication. But, you know, we're hearing really, really good experience with this survey, how the results of this survey are really making a difference, so we're kind of excited about that.
This is such a great example of, you as a nurse, as a CNS working in an interdisciplinary team. Do you think that made a difference? Because there are teams of just medical researchers, just nursing researchers, but speak to us about the benefits of working with different members of the healthcare team.
Absolutely, and no matter what type of nurse or nursing situation, I highly recommend don't take it on yourself, right? Pull in all disciplines because it's the patient, right? To me, as a nurse, we advocate for the patient, and it can't just always be the nurse, the nurse. I think we should approach patient and patient care as a team, right? And a variety of team members, right? Nursing, medicine, chaplains, OT, you know what I mean, occupational therapy, speech language, physical therapy, social workers, right? Adjustment to illness, chaplains, religious ministries. They come, if you bring this team together, that's what we did. You'll see all aspects of the patient experience.
That's such a good example of that, and it's making me, as I, develop my research acumen and hopefully become a nurse scientist myself, I need to be more conscientious of that because we do like to silo ourselves with people that think the way we think and have this similar interests, but you can accomplish so much more clearly as evidenced by this work when you work with different members of the healthcare team.
Yeah, and I'm sorry, don't forget the patient. If you're gonna
Yeah.
create something, don't forget the patient. I have to tell I was a little nervous at first to start talking with the patients about their experience, but we did focus groups, we did about 7 of them, and everyone was so heartwarming. The patients were very, very willing and concerned about their experience, where they were at, and it was just wonderful. So, no matter what type of nurse you are, again, if you're out there and you want to measure something, ask your patient what works for you, or what is it about this particular concept from your perspective. So, don't forget the patient.
I love that. So speaking of measuring, you're a CNS. So do CNSs do a lot of measuring? Talk to us about that job and that profession.
Sure, sure, sure. So, clinical nurse specialist, right? That's one of the APRNs, advanced practice registered nurses. We have clinical expertise. So, that's one of the things about a clinical nurse specialist. You have clinical expertise in whatever field it is. My field is neuroscience, nursing. That's my clinical area. So we are all about improving outcomes, whether it's a patient outcome, whether it could be a unit outcome, it could be the hospital system outcome. We also have, like I said, expertise in patient care. So some CNSs do direct patient care, right? Because we know the literature, we have the experience, the expertise. The other thing that we're really good at, that we're trained to do, is evidence based practice. What does the literature say? I feel our role is know the literature and bring it to the bedside nurse, because the bedside nurse doesn't always have time to go look at the literature. So use a clinical nurse specialist to go get the literature, because they are very good at finding literature. They collaborate with librarians, the medical librarians, the nursing librarians. I have some dear, dear librarians. Trust me, they save my ass every day because they help me find the evidence. So, yeah. And then the last thing, like I said, as a clinical nurse specialist, a lot of times we're asked to help optimize systems at the hospital, whether it's products, whether it's equipment, whether it's clinical outcomes, the good old falls, the hospital infections, whatever it is. As a clinical nurse specialist, we look at process. We're very good at process. We're very good at quality improvement. We're really good at looking at process and finding what's broken. We're really good about rapid cycles of change and, putting in new interventions. So, yeah, clinical nurse specialist, go.
I That's so great that you are an incredible cheerleader for that profession. I worked with a CNS in my prior role, and I throughout the months and years I worked in the same office, I saw the work that they did, and it did really help. But I will say I appreciate you explaining that because my first time in nursing as a new graduate and even as an experienced nurse, I really had no idea of those other pathways that are extremely crucial to the United States healthcare system and globally, and I just didn't know that that was even a thing. So I'm
Yeah,
really glad you explained that.
yeah, you bet, you bet.
So as we're finishing up here, how can a bedside nurse take all this that you have, you've this work that you've done, everything that you've shared, what can, they do with this information now that they know and heard about it?
Okay, great. I think every bedside nurse should look at their patient and what outcome are you expecting with your particular patient? And is that outcome measurable? And how can you measure it? I would, again, pull in a team and ask, do we have a tool to measure this? I'm really concerned about this particular type of patient's outcomes. And again, call in a team, think about what is it that you could measure. And again, if you measure it, then you could get results, and then you could do something about the results. So I think as a as the bedside nurse, look at your patient. What do you want to improve? What could get better? And then find something to measure it. Or how great are you doing? How well is it? And then again, find a tool. They don't have a tool. Well, now you know how to create a tool. Create a tool and then gather data, look at your results, and make improvements.
So incredibly well said. I mean, it's uh it's a big effort that nurses should make. And I say that because of our position in healthcare. We are, one of the most well, the most trusted profession, and patients really look to nurses to help them heal, help them feel better. And so when you have that kind of person, why they started in the profession, seeking the answers for their, that reflect the outcomes to try to improve them, I think that it's mutually beneficial.
Absolutely. Absolutely.
And so, really appreciate your time, Dr. Bautista. This has been incredible. I've learned so much. It's such an experience to talk to you. It's clear your passion for the work that you do, for the patients that you directly and indirectly now on a national level will impact. I mean, I think feel very confident to say that you will impact these patients. And so it's just such a pleasure to have you on the show to discuss this.
Oh, thank you. Thank you. This has been awesome. Really appreciate the opportunity to share our work. And hopefully others would get inspired to, yeah, let me check out a few outcomes, or if anybody is in the psych nursing arena, I would be, asking, are we using the survey? Where is the survey? What are the results of the survey? It'd be great.
Yeah. And so how can listeners reach you or contact you if they had any more questions?
Sure. I have to tell you, I'm old. I'm an old school. So the best way is email. Email me. And of course, I got that good old AOL email. So it's CAB, CAB. Those are my initials, CAB. Brain. That's my specialty. Cabbrain at AOL.com. You can find me on LinkedIn too. So that would be Cynthia Bautista. And that's Bautista.
That's incredible. You need to make a podcast, Cindy. I mean, you're so engaging. I love it.
Thank you. Thank you.
Awesome. I appreciate you. And that is a wrap on this episode of the Researched RN podcast, your virtual journal club on the go. I am your host, Stephen Kuzmenko. I'll have new episodes out at least monthly. If you have a journal club at your job, you want me to cover the article as an episode, let me know, and I'd love to hear about how that improves attendance or even the quality of discussion. Email me at researchedrnpodcast@gmail.com with any articles or topics you'd like for me to discuss. Connect with us on LinkedIn, and if you enjoyed today's episode, please share with a friend. It would be a huge help if you gave me a positive rating so others can find me. For any listeners that like to read, you can find a discount code to thriftbooks.com in the episode notes. Use this code to get a free book when you spend $30 or more. Thanks for listening, and be sure to tune in to the next episode.